Okay, welcome to the Equine Holistic Equine Academy of Lymphedema. I'm Teresa Mule, and a very warm welcome. If I could put my arms around you and hug everybody, I would. All right, but I just got to do it through the phone. So just know that my heart's out there. So is an exciting night because what we've really done is we took it from, and we're going to go through the stages again, but tonight is really learning to see it through different eyes. And I'm going to give you some really personal experiences here. And I want you to really relate this because, and I truly believe this in the bottom of my heart, by knowing some of this information that we're going to share and seeing it through different eyes, I think, and if it's not your horse, maybe it's you, maybe it's your husband or somebody that you love, that you're gonna that it's going to impact, and you may not have all the answers, but you know where to look. On that note, that's why we see the horse differently. We're going to get started. All right, so we went over this last week again. Remember, 9 million horses, 8 to 10% have chronic swelling that never goes away. And we're looking at anywhere between $1,200 to $1,500 on the acute phase, a reoccurring 650 to 750, and anywhere in the 3 to 5 year range, you're looking at $10,000 to $15,000, if not more. And I believe it's costing the industry at least $828 million a year for something that we just don't recognize. So now we're going to be looking at this photo a couple of times. So we went over it before, and we're going to go over it again tonight in a different venue. But this is the connective tissue, and it does matter because every one of these here is connective tissue, and it impacts this. And we're going to get more into that as we get into the rest of this manual lymph drainage. Now, last week, we talked about the grooming technique. Again, remember that the grooming technique, I want you to think of the connective tissue and the lymphatic system. In fact, it's the connective tissue that is one sheet. It's fascia, all right? And then underneath that, these are all the lines there. And in the grooming technique, we have 6 sections, all right? And we're going to look at the direction of the hair because of the direction of the hair is going to lead us to where the nodes are. And that's what we want to do. We want to move. Just think of it this way. It's a highway system. And when if the highway is congested with cars, what happens? Everything backs up. And until that congestion is relieved, it's bumper to bumper. So we all know that drill real well. So the body works very similar to that. And now we're going to get into the manual and drainage. Why does it really matter? First of all, it's a very slow, light feather touch to the skin, and it's a has a lot of rhythm to it. It has rhythm to it. It has a beat. And what it does, it stretches the loose connective tissue just beneath the surface here and it directs everything into the nodes. So that's what manual lymph drainage is. And we're going to compare the grooming technique tonight to the MLD, and we'll show you how they're alike, and we're going to show you how they are different. It is not in the scope of tonight's presentation as to when you're going to use what when. That will be another time. But right now, we just want to just highlight it. So let's go over this again. So manual lymph drainage, why does it matter? First of all, it stretches. What is it stretching in here is everything in this underneath the skin. I mean, I don't know. Oh, well, good. It is a PowerPoint. I can see if I can
Are
fix
you
it.
are you trying to show a slide?
Oh, yeah. Why? You,
I don't see a slide.
you don't see a slide.
I see it.
Oh,
You
you do?
can?
I see it. Yes.
Huh.
Uh-oh. Does anybody else having a problem? Yes or no? Can you see this? Estelle T?
We can see it.
Okay, good. And this to me, let me go back. I love this picture
Maybe if
from
she refreshes, it'll come back.
you. Did you hear that, Lorna?
Yeah.
All right. So this is really what it does. When we stretch the skin, underneath this dermis and the epidermis is this loose connective tissue. And the pink in the background is ground substance. And that is what we feel when we do the see, touch, and assist. See, touch, and assess method, and we feel resistance or restriction because it solidifies. It's just like chicken stock or beef stock, is everything in the pink. Now, this is interesting. Underneath here, okay, is where the exchange between the blood and the lymph happen. I don't have that photo up here, but when it gets congested, these are collagen fibers and these are elastic fibers. They begin to break. Why? Because there's so much pressure in there. That is why people have problems when they have cellulitis. There's an infection in this area. That's what cellulitis is. You break the skin, bacteria gets in, and then you have an infection setting in. And the infection is in this area. And what the infection does, it destroys tissue. This is what most people don't even realize, that lymphatic fluid is toxic. It destroys tissue. So somebody says, you see it all the time. Oh, the horse has had a swollen leg for years. They're eating, they're pooping, they don't have any problems. I can't tell you if you ever will, but that is not something I would recommend at all. That needs to be moved. So what it does, it stretches and opens and closes. Remember last week we talked about nature's law. Everything open and closes. It can go by different names, whether it's, the ebb and the flow of the water coming in and out. Your heart uh, does that, your lungs, reproductive organs, digestive, urinary tract. You ever get a bladder control problem as you get older, especially for females, if you had hysterectomies or you've had children, everything gets stretched out and then you can't hold it anymore because all of these elastic fibers and the fibers are a little bit overstretched, if you will. And what this actually does when we move it with our hands, this if you put your hand on top of your hand and just stretch it, what you're doing is creating space. And people say, yeah, what's the big deal about space? Let me tell you, this space is critical because the most important thing that space is going to do is move the debris and bring oxygen and red blood cells into the area. Let me give you a tip. It's not on here. When your body has a lot of oxygen in it and the red cells are moving, all right, you don't get swelling. So if you see a horse that I got swelling hocks, swelling legs, swelling anywhere, you know they're not getting enough oxygen in there. That is what is so important because when we control that O2, all these macrophages can get to work and take care of the bad guys and push it out into the highway system so it gets urinated out. Most of it gets urinated out. Some does gut pass through the fecal matter in the manure. And it removes waste and toxins like lactic acid. Now, let's go over here. What doesn't manual lymph drainage don't do? It cures nothing. I'm just telling you. What is it creates space. That is the most important thing that you got to get in your. I'm creating space. I am taking all the cars and all the debris that's in the highway system and removing it. And when you remove the 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 the, the congestion, what happens to the flow of traffic? It moves, right?
Hmm.
Same principles. And let me tell you this, as a practitioner, I get this quite often. Somebody and it's a panic call. Oh, Teresa, I just did an MLD session, and the lady said I got an abscess, and another woman tell me I caused laminitis. Nonsense, absolutely nonsense. First of all, an abscess is a bacterial infection stuck in the connective tissue. Period. All right. You have nothing to do with creating that. What you may have done was get the congestion out of the way and push the abscess through so it could get exposed. But you did not cause an abscess. Get that through your head. You did not cause that. It is caused by cracks in the hoof, wet ways that for the bacteria to get into the hoof, numerous ways. Same thing with laminitis. Laminitis is the inflammation of the laminae. The laminae is connective tissue. It's the sticky stuff that when you peel back the chicken, when you're skinning, you're taking the chicken, the skin off the chicken, you see this film that's in there. That's your areola. That's like the glue. An enzyme does that. There are enzymes that cause this inflammation. How are you going to activate an enzyme?
Mhm.
Most people they don't even understand it. What they're doing is pulling at straws. So that's why I tell, as a practitioner, this does not cause laminitis and abscesses because I get the phone calls. I get the panic call. I'm afraid I'm going to get sued. But I caused this. You did not cause anything. All right. So, this is not safe for acute infections, including cellulitis, including, tying up. If you got an acute infection, you do not do manual lymph drainage, period. You do not do it because you're going to spread it. You have to wait until the antibiotics get in there. You'll know when the horse feels better. They'll tell you right away. And you go, and the owner will say to you, well, when can you start? I said, when did you finish the antibiotics? That's what your answer is. So if they tell you to take it in 10 days, that's the protocol you should use. Now, many, many times within 48 or 72 hours, the horse is being resumed. They give that extra 10 day. That's a tough call to make. And you need to explain that to the owner. Say, look, the protocol really is 10 days. I feel comfortable with that. But you got to tell me if you feel comfortable. Now it's been 6 days since he's been on the antibiotics. Do you want to wait a week? This is going to be your call. But this is what I'm telling you what the protocol is. Because usually by that time, they're lame. They're lame. When they get that laminitis, or they get laminitis with the CPL, they're generally lame and they don't want to put any pressure on it. Soon you could tell as soon as they start walking and resuming, that's going to be a call really for you to vet. It's a thin line that you're walking on. I wouldn't do anything under 5 days, to be honest with you. I think, but that's going to be your call and you need to discuss it. If the owner feels safe, as long as they're on the antibiotics and they maintain the protocol, that is something because, when does the acute infection really end? The fever is gone. That's the thing you want to know. Is the fever gone? Are they eating? Are they drinking? Are they pooping? Are they normal? Are they going out bucking and being their normal self? Those are the questions that you really want to ask. Now, this is really very interesting. When you're dealing with like tying up this rhabdomyolysis, what that really is lactic acid. Let me just give you an example of lactic acid in real time here. First of all, lactic acid. Now, this is gonna I'm gonna share some personal information about my husband. My husband has major heart condition, and for the last 18 months, it's been I'm gonna use the expression hell and back. I can't even tell you how many times. The month of June, 3 times we went through the emergency room, through the ambulance. The police had to come, yada yada yada. And let me tell you what happened. I can't make this up. And this is why I'm sharing this because when you grasp what I'm going to share with you, you will never look at that body or that connective tissue again, especially if you've got somebody who's got heart failure in your family. So, or pluralistically or long, whatever. So long story short, my husband goes in, he goes into AFib and it starts a slew of reactions. Goes from AFib and then he goes into pre-ventricular contractions, which is deadly. And then it impacts his lungs. And then the lungs, it impacts his bowel movement. So he's constantly going back and forth. And there's this vicious cycle, vicious cycle. So we take him in and he goes in, and the doctor says to me, on one of the visits from last year, oh, you've got your husband has I believe COPD. I said, I've been married to this man 40 years. I don't know anything about COPD and lung. He's never had a lung problem. I'm telling you the truth. And they just walked away. I said, you need to give me information here. I need information because my husband's retired military. He was in a toxic environment for a year where he was stationed. He got all kinds of exposure to environmental toxins that are not normal. And I'm like, maybe it caught up with him. Asbestos takes 30 years, 30 years before it rears its ugly head. So I'm like, okay, I could see that happening. So I said, okay, maybe it's possible. So anyway, long story short, they were treating him with nebulizers. And I said to him after a while, I said, Paul, I'm going to be honest with you. I said, I don't see what this is doing you any good because you don't feel any better. You look worse now than you did before. And he got very upset with me. I says, maybe you should consider not taking them. And his answer was, you're confusing me, Teresa. The doctors told me I have COPD. I need to do this. I said, okay, I rest my case. I said my piece. So in June, he goes to they gave him a nebulizer, and and every doctor we went to changed the inhaler. Swear to God, can't make this up. Why isn't anybody consistent? Why? I need information. Why are we changing from one to the other? I don't get this. And nobody would give me an answer. So last week, we when he was in the hospital last time at the end of June, we were in for July 4th weekend. He had gone in, and it turned out that they had gave him a new inhaler, and he had allergic reaction. That was one of the trips to the emergency room. So the third trip to the emergency room, because he couldn't breathe, and he had been using the inhaler. So it turned out it caused thrush in his mouth and it burnt his lungs, right? So they gave him prednisone. He did great on the prednisone to clear it up. And now we go see the new pulmonologist last Thursday, July 23rd. So I said, she goes, I don't think he has COPD. And I said, I don't think he has it either. She goes, because the pulmonary function test doesn't indicate that. And I said, the new cardiologist said the same thing. I says, can I give you my theory? She goes, sure, Teresa. I says, I'm going to tell you what I think it is. And it's because I learned this. Hear what I'm telling you. He went into AFib because of a lack of sleep. He's got sleep apnea. So the oxygen level dropped, and he ended up having more carbon monoxide up in the brain, which caused him to hallucinate. Okay. And then it went into AFib, pre-ventricular contractions. It impacted his lungs that I think the inflammatory process in the connective tissue got so bad his lungs couldn't pump, and it built water up. So when they took the x-ray, they saw water all along his lungs. That's why they told me COPD. So I said to the pulmonologist, the new one that we have, and I said, here's my theory. I says, I think there was so much going on in that connective tissue, with the breathing, the heart, the lungs, and everything spasmed, and it caused a severe inflammatory reaction in his lungs, in his bronchioles, and the lungs couldn't operate, so it filled up with fluid. Okay, he never had COPD. That's why this is important. That is why I am telling you, get a handle on this connective tissue underneath the skin. Why? The heart has pericardium. It is part of connective tissue. Pleurisy, the lungs got connective tissue in there. Do you see it? Do you see then it went down into the intestines, the mucus lining. What is some of that? It's you're dealing with, you see the connection of all the tissues. So what it really was, he got misdiagnosed because nobody stopped to talk to me about what was happening, or I even to give my input. Oh, he's got water on his lungs, and now he must have COPD. And then every doctor we saw after that read the report, and they said, "Oh, the first doctor must be right. He has COPD." When in the fact he didn't have it at all. What it was an acute inflammation of this tissue that cause a whole stream of effects. That is why this is going to make you an outstanding differentiation between another practitioner. When you're looking at laminitis, I am looking at abscesses, I'm looking at navicular, I'm looking at, suspensory, wind puffs. All of this is right where we're talking about. So when somebody starts talking, that think a minute, step back, and think about how this is all reacting. The same thing with there's somebody on Facebook that trying to do a study on why horses don't sweat. I think it's a congested lymphatic system. I think that is a definitely a critical player. Is it all? Probably not. There may be other genetic or things that are going on in a horse that may be masking it. But if you can get rid of the congestion, you may just find what the root cause is. And it could just very well be a congested lymphatic system. And it's all in this connective tissue. So the new theory they have in tendonitis is that they believe it's a mechanical irritation because you're doing repetitive. Think about what the horse is doing, whether you're doing dressage, it doesn't matter what discipline, it's mechanical. And it releases biochemical and metabolic changes in here. And this is the collagen, this is the elastic fibers that get damaged. And when they get damaged, things begin to go south. Does that make sense to anybody?
Mm-hmm.
Any comments? Does anybody have a person in their family that's had heart failure that you could relate to this? I want you to think about this because
Yeah,
somehow
I do.
I think somehow you may be able to save somebody's life. That was a misdiagnosis. All these trips to the ER for the last 18 months have been on and off because of this nebulizer, because somebody didn't understand this connective tissue and the inflammatory process and how important it is directly underneath the skin and how it impacts the heart. Think about that. That's scary, folks. That
Mhm.
is scary.
And it sounds like they didn't really look at the pulmonary function test and interpret the results for themselves either.
They just took it on Thursday. But the key
Oh, okay.
was,
Okay.
the key really was that he couldn't tolerate any kind of inhaler or
Mm-hmm. Mm-hmm.
nebulizer in the hospital. Well, that
Mm-hmm.
should have been a red flag.
Mm-hmm. Just a quick thing, just for you to file away, for later. I don't want to stop the flow of what you're doing, but those horses that have the anhidrosis that you were talking about, um, that someone's doing research on, do you know if they have looked into thyroid cascade and in relation to that?
I don't know. I saw it on Facebook. They were doing a study, and I want to go back and find it. So if
Well,
you want to go Google
I
that,
can't look at anything on Facebook at all,
okay. I'll
but
go look
I'll
it up
just.
because I want to contact them. I want to know more about what they're doing.
Yeah, yeah. I just wonder because in humans, um, anhidrosis is often a clue to hypothyroid.
Well, that's good to know. I didn't know that. I wouldn't
Hmm.
be surprised because the thyroid, it's very interesting because the thyroid is, first of all, it's connected to breast tissue too.
Oh, to everything. Yeah, I
Yeah, it
mean,
is.
yeah, yeah, yeah.
Yeah.
Okay, sorry.
Uh, that's okay. But I just wanted to share why this photo is so important. And that on your journey, as you're meeting horses and you do the see, touch, and assess, think about this photo. Think about what's going on in here with the collagen, congestion, the fibers. If there's an infection in here, these little rascals can't, the macrophages and the white cells can't do their job because they're stuck. So our job is to make space. So when we take the garbage out of the house, what happens? The smell dissipates,
Mhm.
right? You bring it out to the curb or wherever you take your garbage. That's my point. So that is why I think anybody on here, when you are looking at whether, regardless of what it is, take a hard look at this connective tissue and visualize it in your mind. What is going on? If you have a condition and you don't know if connective tissue, what part of it is, go Google it. Like guttural pouch. They'll tell you this connective tissue in it. Bingo. Anything, any condition that you find and you're not sure of, Google it and find out, gee, does this have connective tissue? If it does, you're going to know immediately the grooming technique MLD is going to be applicable. That is a clue for you. Any questions?
So I have a question. You said, well, for the cellulitis, if it's not acute, I mean, if it's acute, don't do MLD. But what about the grooming techniques?
No, no, you can't
Oh,
because you're moving infection.
okay.
It's totally. Now, what the grooming technique would be very good for is a horse that's stall bound.
Mm-hmm.
Now, a horse that's stall bound because, they have an injury to the hoof or whatever it is, they can get pretty hyper in there, or they're in such pain they don't move. They're like in a comatose.
Mm-hmm.
You don't want to overreact a horse that's very hyper. You're going to want to do an MLD session. You know, so
Right.
you've got something that maybe is very, very quiet. To me, I like to do the slow and the easy because it infects the pain receptors.
Mm-hmm.
When you do it too fast, it stimulates them. So you
Right.
got to know your purpose. What am I going in there for?
Right.
Tia, let me make sure I have your address. Did you get my email? T? All right. Anyway, these are just how does
Sorry,
Matt
I had the
that's okay.
microphone off because there are a lot of goats in here.
Oh, that's okay. I love goats and I
We
got
just
four
had,
myself.
have you, what kind?
Oh, they're dwarf Norwegian, they're dwarfs, what do you call them?
The Nigerian dwarf?
Yeah,
Yeah,
but
that's what we have, dairy goats, and, um, we have brand new babies that were born on the 22nd and the 23rd. Um, so yeah, their mamas are still in here until they clean.
oh, I
Um,
love goats. They're so
yeah,
funny. Oh my God.
they're hilarious. But anyway,
But
yes,
did you get my email? That's all I said
yes,
because I
yes.
did. They said that the website's fixed, so I said, like, I don't
Oh,
know.
okay. Yeah, yeah,
I
I
need to
did.
know that.
Yes, I've been getting them. Yep.
Okay. All right. So I just let you know the website they said was fixed and they're
Okay.
able to get in it. So if you're
Okay.
not, you need to let me know if you can't, and I can get you in
Okay.
the back door. All
Okay.
right.
Super. Thank you.
You're welcome. So anyway, the manual lymph drainage is used not just for cellulitis and CPL. That happens to be my niche because I had a horse with intermittent lymphangitis, and that's how this all got started. But MLD has far more implications. All right. This one, I don't know what the deal is. We're seeing a lot more ventral edema. This was a mare from a couple of years ago. She just blew up. She was 30 years old and she just blew up. And again, I don't know how many thousands of dollars they want. They didn't give me a number. But when Maddie did the MLD on her, the only thing that horse wanted to do was stretch this way. Stretch. Because when she was stretching, she was releasing pressure. So somewhere, and I think it was in an ovary. She said somebody took an ultrasound and when she first contacted me, goes, Teresa, what do I do with this? And I said, well, this is an interesting case. I never had this one before. I says, well, and here's what I'm going to tell you. Go back to your foundation. Your foundation of understanding how this works every time. I said, Maddie, we're going to go back. I don't know what the root cause of this is, but we're going to go back and do what the book says it does. We're going to stretch. We're going to do, and sure enough, now it continued. She did continue to get lower. She would lose it. And then she didn't lose all of it. She'd lose some of it, but then it would come back. So I don't know what the end result really was. This is CPL here. This is where Um, I love CPL, not that I love it, but I love working on it because it's so challenging. And I made such a difference. And when a horse has CPL and you wrap them, you will see the difference in a matter of hours and hours, not days, hours. This is a horse with cellulitis. Same thing. If it's an acute infection, you're not going to do it because they'll kick you. It's very, very painful, and you're not going to go near a horse that's going to kill you. That's because it's so painful. I'm sure all of us may have experienced a hay splinter at one point in our lives and they got swollen. That's cellulitis, and it throbs and it hurts. And it's very destructive. In a matter of hours, it can destroy in a total lymphatic system. Now, what else is it good use for? This is scar tissue. Scar tissue here. This is Romeo. He was a stud. Well, he still is. And he thought he was going to visit the ladies over the fence, and he didn't make it. And he got all tore up, and he had scar tissue really bad. And when we started doing the grooming technique in the MLD, it came down immediately. Here is also a runny nose. You'll see it quite often. What it just means is that they're congested, they're overly congested, and the body's trying to get rid of the contaminants, especially, and they do like face massages. Contessa likes them. So, and then and sometimes you'll even see it a day after. Sometimes it still drains. It all depends. Same thing with the tear duct up here. There's a lot of congestion where they put a tube down there and they'll blow it out. You can just as well do MLD and get it done. Now, a swollen sheath is underneath here. That's from a gelding. It's a gelding scar where they were gelded. And now lymph can't pass scar. Now, this is post-surgical. This she had a mast cell tumor here. Let me go back. This is it right here. That's the ma Come on, Teresa. This little rascal here is the mast cell. And that was Galaxy. She had a tumor there. And what we did, and that was about a month old by the time I got there. She was, well, she did live in Texas, but anyway, we worked it, and that thing came right down in a matter of minutes. All right, so that's the different uses of manual lymph drainage. So it's just not swollen legs. So there's many, many uses. And one of the things, let me make sure I didn't screw this. Okay. So the other thing here is I wanted to share with you the difference between the grooming technique and manual lymph drainage. Both utilize the hide as a compression garment. Both of them do. All right. They both follow the anatomical flow and they're both going to drain. All right. Let me, welcome. We have a new person here, Joe R. Thank you. Thank you for coming. Anyway, we're going over here. What's the difference between the grooming technique and manual lymph drainage? And so here's where it goes. They both utilize the hide as a compression garment. It drains and it follows, both follow the lymphatic flow. And here's the difference. The grooming technique only the direction doesn't matter. But in MLD, it does. You go proximal to distal. That's it. The number of strokes for the grooming is a spiral or a circle. And then we have 5 strokes in the, oops, we've got 5 strokes for the MLD. And the speed, you can go fast to slow. This is slow. It's 1 second intervals because that is the natural rhythm and timing of the lymphatic flow. So when it goes from one lymphangian to the next, it's in 1 second intervals. So now we need to redirect a swollen limb. Will the grooming technique do that? And the answer is no, you're not. You're going to have to redirect it. Oh, I can't do that there. I was going to fix that. But in manual lymph drainage, let me just put it this way very simply. When you think about manual lymph drainage, okay, and you're going down the highway and the highway says detour, you're not going down that road. I don't care what you're going to do. You're not going down that road. It says detour. It detours you because it wants you to keep the flow of traffic moving. In addition to that, okay, in addition to that, they want to keep the flow of traffic moving because they don't want backup. So when you do the grooming technique, you're not redirecting anything. You're going to have to know the 7 territories. You have to know the direction of where the nodes are, and you need to have a very specific, there are 3 specific um, sequences that we use. So who can use the grooming technique? Any owner or a professional. Manual lymph drainage is usually for the professional. We do have some very, very advanced owners who absolutely love manual lymph drainage, and I would say absolutely come in. When you're advanced, go for it. You know, why not? Why are you gonna take somebody's thunder away and not? You want to give them everything. I want to give them everything I got in here.
Teresa, can I ask a question?
Ask.
So you said with the manual lymph drainage that it takes 5 strokes.
No, there are 5 different strokes.
Oh, 5 different strokes. Okay. Now, what did you say was the what it was for grooming?
It's only 2. You either
Okay.
do a spiral, which is this, or you
Uh-huh.
do a circle. That's it.
Okay.
And they're very different. They're very speed doesn't matter. Remember, you're using the compression garment. That horse
Mhm.
is every time that horse moves, that compression garment's working. And the only thing you're doing with the grooming technique is following a pattern to move with it. You're not, but when you do manual lymph drainage, that's on a deeper level, it's very slow. And it will drain, but I will tell you this, you're not going to drain a horse that's got a swollen leg from cellulitis that's chronic with the grooming technique. It's not going to happen. You will drain a lot of it with the manual lymph drainage because that actually um, tackles the inlingual nodes. In other words, there's a part in the rear leg that you need to tackle the inlingual nodes, which are actually about right here. That's why we put our hand underneath the horse, and the inlingual nodes are the ones that drain the leg. So that's a professional. The grooming technique is just I just want to keep my horses. I got to groom my horse anyway, so I want to make it, very productive. I want to move any kind of lymphatic congestion out, and that's what you're doing it for. For relaxation, you also want to use the C-touch and assess method. That's free. You want to make sure you look at the direction of the hair. Make sure wherever you're going, you brush, you follow the hairline because that's going to take you to the nearest node. And that will help you tremendously. I've seen really remarkable things with the grooming tech. Incredible. But if you got a chronically swollen leg like Tom had, he was like over 36 inches in diameter, that's not going to cut it. We'll do another session on CPL and the proper protocol and the proper wraps, why it works and why they don't work. So that's what this is. So this is the grooming versus the manual lymph drainage. So next week I made this a little bit short here. And Lorna, look at this. We got Lorna right here. She's going to be one of on our next week. We're going to be doing a panel discussion on the people who are moving this industry forward. We have Trish here from Maryland, Tracy from Colorado, Lorna from Arkansas, and then Lori Hicks from Texas. And she's been doing a really great job. They all have been, and they're making everything happen. Slowly but surely, we're moving forward in this industry. So that's what that is. If you haven't done it, please join the lymphatic movement. We're trying to get some speed up to there. Um, and do you have any questions? I know, Joe, you joined late. What can I help you with?
I'll get what I missed on the replay.
All right. Well, we can do a really recap. Does anybody have anything?
I have a question.
Yes.
On last week's video, I watched the replay yesterday, and you were talking about how this could help mares with mastitis,
Yes.
but how you have to be, very careful getting your hand up in the groin area because the mares are in a lot of pain, and you just have to be safe with it. can they, would it be all right, or is it possible for the vet to give the mare a mild sedative?
I would tell you this, mastitis is an infection.
Yeah.
That's a red flag. You don't do it when they have an infection. They're miserable. You wait till the infection breaks until the infection settles down before you tackle the mastitis. That is not something that you would do because you're going to get kicked. And then they're very protective of their space. Now, the lady next week that'll be here from Texas, Lori, she was working on a big horse. I forgot what he was. It might have been like a warm blood, a cross warm blood. Everything was fine. She put her hand inside his thigh and he turned on her. And he let her know under no circumstances are you going into that area. You're not going. And it took her back. And so I always tell people, if you, especially if you've got mastitis going on, that's a vet's call. It's an acute infection. You got to wait for the fever. They give them antibiotics, whatever it is that they do to get it under control before you go do it. Does that answer your question, Donna?
Yeah, I didn't know if they would still be hard to treat even after the infection goes away. That's what I was getting at.
No,
They're
if
still,
what, yeah, once the infection goes away, a lot of the pain goes away because the swelling's gone down. All right.
yeah,
And so then you can get in there. And then, but you got to know the horse. You know what I mean? You just got to, you got to walk very gingerly
yeah,
because you're in a very prone position there, very vulnerable position due to body mechanics getting your hand underneath there. So I would be real careful about it. What you could do is I wouldn't go and go. I would go as far as I could up at the inner thigh. They'll let you know if you're getting too close.
yeah.
They'll swish their tail, they'll turn their heads,
Mhm,
they're going to stomp, they're going to move away. And those are all indications for you to stop. You've hit the limit.
mhm.
Come back another day and maybe the swelling will be better and be gone down and it won't be painful and then you can resume because the chances are when you get in there and be that light touch, it's going to feel so good. So good. And I saw it with Tom. Tom was the first horse we worked on. His legs were 42 inches in diameter. And he came in from the field. It was one of the coldest days I've ever had. It was -10. We were up in Massachusetts back in 2010. And let me tell you, he did not want to be there. And he wouldn't stand still for nothing. He was polite, but he didn't want to stand. And then when I started touching his leg on the outside doing MLD, he got as quiet as a church mouse. He never moved. So that's going to be an indication to you. So, that's why the see, touch, and assess becomes so important because you're going to know right away without being threatened. It's a safety issue. Anything else, Donna?
No.
T. Oh, T. Uh-huh.
Okay,
Joe.
sorry, I had
That's okay.
forgotten to
You with the
change the
babies.
phone over again. Yeah. Otherwise, no one would be able to hear anything. Um, anyway, the one question I had was I thought I heard you say to move from proximal to distal.
Yes, when you do MLD.
Okay. And and so
Wait a minute. Proximal distally. Yeah.
yeah, so
Mhm.
I'm thinking you're going from from the extremity towards the center is how I thought I was supposed to be doing that, going towards, like uh,
Wait a
if,
minute. You're talking about MLD. The grooming technique, it doesn't matter what direction.
right, right. But I thought we were supposed to go from no matter what you're doing, if you're trying to bust bad things loose and let them go. You're not in an acute infection. You're past the 10 days with the antibiotic. You have no fever. They're eating. They're
They're
active.
doing everything.
Oh, yeah. Okay. So now you're ready to do your MLD. And I thought you were going from, like, say, the hoof back up towards one of those zones that you had pointed out where the nodes
All right.
are.
Okay. All right. Here's what I mean by proximal to distal. All right. All right. Here is the hoof, right? Let's say the leg is swollen. About, doesn't matter which leg. Okay. You don't start here and move up. All
Okay.
right. You start here and move here.
Okay. And then you step it down. It's like
Then
untangling
here.
girl's hair.
That's what I mean by proximal to,
Okay. So let
you're
me
clearing the
replay this.
pathway.
Yeah, let me replay this and make sure I've got it because I think I got it now because it was not making any sense to me because everything I'm thinking I thought we started at the other end and moved it towards the garbage chute, right?
Mhm.
Yeah.
Yeah, but so if you have a little girl or a horse with a mane and a tail that is tangled, and you want to comb it out, you don't start, just yanking your brush all the way down or your comb all the way down. You undo little tiny bits at a time to make way to undo the rest.
Right. I always
So in
start
this
one. Yeah.
case, if we were going to start with the let's say the rear, like you're showing with the hind leg, so we would start right up by almost at the hip, almost, and work our way, like clear that path and then move down like an inch or two or 4
Right.
inches or so
Well, usually what I do
and
do
move
is with
that.
my hand. Okay. There are two main drains, this drain and this drain.
Right.
And you want, when you're doing, whether you're doing the grooming technique, this is the lymphatic flow, by the way. I actually had extra paint tape in my house and I thought, oh, this works really good. It's colorful. So, but
Yeah.
it's expensive. I didn't know that paint tape was $6 a roll. I went out
Uh,
and got my little masking tape here for $1.99, and it works just as good, but it's not
yeah.
as colorful. Okay, so here is the drain. So if you notice, everything is going down to the drain. Everything's going this way. This is the main highway. Think of it as the federal highway system. So it's
Okay.
pulling all the lymph from the back, bringing it up here, and it gets deposited into the venous angle. Our venous angles are right over here, right
Okay.
underneath here. So, and it goes into the circulatory system. And then they
Yeah.
urinate it out. So you're going to want to start from here to here. You go from here to here, from here,
Mm-hmm.
because remember what the pumps do in the horse's hoof. Every time they go down, it starts that pumping action to move the blood up the leg, right? So now
Mm-hmm.
you've got the skin working with the hoof pump. Think about that. That's pretty ingenious because now every time the horse moves and you move when you do the seat touch and assess, you put your hands around it and you just slide up and you're going to feel if it's loose or not. And that is one of the ways that you tell if it's a good lymphatic flow in the legs, is that you go here, you put your hand on in the inside and the outside, and you just slide the skin. Now that skin should be loose all the way down to the coronary band. If
Okay.
it's all right, if it's not, that means they have good circulation. They've got good lymphatic flow.
So start at the top and free that up.
No, all you do is going to stretch the skin. You're not going anywhere. All I want you to do is stretch the skin and
Right.
go up.
But we're freeing it up so that the rest of it from further down has somewhere to go.
Right, you just cleared the highway. That's
Mm-hmm.
exactly what you did. And the
Mm-hmm.
same thing here. So if she's got mastitis, this whole area here is going to be congested. So you're going to move from here to here, here to here. But when you get underneath here, they get very touchy about that. So you can put your hand inside. See this is where the lingual node is. That's going to drain the leg. And that's going
Mm-hmm.
to, okay. So when you put your hand up, that's actually where, think about this from an anatomy point of view. This is where the leg and the trunk will hook up, in that curve, in that there's it bends just like us in our where the leg is that's where you want to put your hand underneath here, but you got to be careful because you don't want to get kicked. That's why I tell you, don't do anything especially mastitis or, because they can be very, very touchy.
Okay, now just a quick follow-up to that. So, assuming that we're working with a mastitis or a problem with the rear leg, should we do even if we know that that's where things are, we should start in the front on the seat touch and assess, make sure there's no restriction and that things will flow well there so that when the bad things want to come down the federal highway and dump into the front
Yep,
garbage chute, then it'll all be clear and good to go.
pretty
And
much so.
and then go work the back end.
Right, right. Just follow those hairs because those hairs are real important. Because
Yes.
you see the hairs, they're going to go around this way. They're going to go around this way. And that is when you look at the grooming technique. Um,
Mhm.
we do the this way, we do the all roads lead to Rome, and we tackle this up here. And when we do manual lymph drain, it's a little bit more. We work on the aperinosis that's over here, where the world is, this world. When you
Mhm.
see a world on a horse where the hair is, it means it's changing direction, lymphatic direction.
Mhm. Mhm.
So yeah, you follow the hair. All right. So anyway, that's that. Well, that's for another time. But anyway, we're going to move from here to here, here to here. Now, let me tell you about the legs. Most horses that I have done or have got, God rest his soul, Tom had fabulous lymphatic flow in his front legs. Fabulous. The skin just moves like that, and that's good. It's always the hind that are problem. I would say anywhere between 80 and 90% of the horses are going to get stuck. You're going to feel the resistance. You're going to feel the resistance. Soon as you put your hand here and move it up, you put your hand in the inside of the leg and the outside, and you're just going to stretch. And you will, when you feel resistance, that's telling you they're congested in the leg. And that means if they're congested in the leg, they're congested all in here too. All in here. It's just not the leg. So this is why that seat touch and assess becomes so important. They're very special pathways that go through the hock here, and most people don't even realize what they are, what's over here. And I'm not a fan of a lot of injections, only because, number one, the cortisol does damage long term. They give you a short term fix, but it doesn't really solve a long term problem. Um, and it also, every time they put an injection, there's scar tissue, and lymph can't pass scar.
Mhm.
So you may have a lot of horses that have been injected a lot, and you're going to see it in here. Now, what I will tell you, a horse that has laminitis, active laminitis, you're going to feel the resistance there, or you may feel total restriction in the leg. And that's going to tell you, like Contessa, my little mare here, she had two abscesses in the right front. I can tell if it's coming, if there's trouble brewing, because I go do the seat touch and assess. If she's got good lymphatic flow, the hoof's good. That's great. If she's got an abscess there, I can almost guarantee you're going to feel resistance going down to the cannon bone with the skin. And that's something so important for horse owners to know. It takes you 2 seconds. You just go there and lift the skin. And then you then just go down a little bit more, down a little bit more, and you're going to see, because sometimes, especially in the hock, they may be over here, but when they get to the hock, it gets real stiff, and then it opens up again when you do the seat touch and assess. So it's telling you, oh, my horse is lymphatically congested right here. So when you do the grooming technique or you do the MLD, you're going to take the extra steps. You may, instead of doing 5, you may want to do 7 or 9, strokes. That's where that value comes in, because you'll
Super,
feel it. You'll
super. Thank
feel
you
it.
so much. I really appreciate the extra explanation because I was not clear on
That's okay.
the proximal distal thing. Now I get it.
Yeah, but see, when you do the grooming technique, it doesn't matter because you're just moving the hide. It's the compression garment. You're just
Hmm.
moving it from back and forth, and it automatically will go with the flow and drain. But when you do MLD, you're very specific. You have to know there are 7 territories, and you got to know which territories are going to where where is it not congested, and that's where you're going to want to move the lymph. So you've got some options
Mhm.
here. But the grooming technique doesn't cover, that's not the purpose of the grooming technique. The grooming
Right.
technique is just get rid of the dirt and grime. Let's get the lymphatic system, going, and that's it. That's what you're doing. But
Mhm.
you can get remarkable, remarkable results out of that grooming technique. That pays dividends
Mhm.
way beyond. Nobody wants to spend $10,000 on vet bills. I know I don't.
Yeah. Yeah. Well, I like to understand the whole, even if, even if you were going to do, renal surgery, I'm certainly not going to do it. I'm not a surgeon, okay? But I like to understand the background and the why and
Absolutely.
all that. That's just how my brain works. And once I understand that, that helps me do my part of things better. So, yeah.
Absolutely. And that's what, I think you missed it, the incident with my husband, that we finally, for the last 18 months, he was diagnosed wrong.
Yeah, no, I got that.
Yeah. Well,
I
yeah.
got that. Yeah.
Let me
And,
tell you, that was life threatening. One night
oh,
he
yeah.
turned blue. He turned blue.
Mhm.
And I had to call 911. So, I mean, like, and nobody bothered to question it. And I kept asking, and they laughed at me. I even told his first cardiologist, I says, I think it's coming from the AFib and the lack of sleep that's causing all the gyrations, that's causing the downstream. He just looked at me like I had three, like, yeah, okay, whatever, Teresa.
Mhm.
And I turned out another cardiologist and his pulmonologist in the last week told me I was on the money.
Mhm. Mhm.
And that is why this became so important because this is connective tissue, folks. They didn't even think about it. They didn't even think about what, that he was in a highly, highly inflamed state and it tripped everything and it mimicked or what they believe was COPD and it wasn't COPD. So they were treating him with the wrong thing. And then you wonder why he had a allergic reaction to the medication because it was the wrong medication. It was the wrong diagnosis.
Mhm. Mhm.
You see how this will help you in your own travel journeys.
Yeah, this is terrific information. Very, very helpful information.
This
Thank you.
this is
Thank you.
gonna help somebody figure out what I figured out. And you know what? And they couldn't argue with me because they knew I was right. They finally said, I think this lady's right. And I'm not a doctor. I didn't go to medical school. I didn't go to nursing school. In fact, his cardiac nurse was here last Friday. She didn't know anything that the lymphatic system was. She's a cardiac nurse. Didn't know that the lymphatic system was connected to the heart. She didn't know that.
Oh.
She
That-
said, Teresa, we're not taught that. I said, well, I just taught it to you. You see, what most people don't realize is if the lymphatic system tanks, it's over in 24 hours. Period. You're done. It's lights out. And when he had his first heart attack, the nurse came to me and said, oh, he's in congestive heart failure. And I almost went into heart failure. I said, if that doesn't clear up in 24 hours, he's gone. She goes, oh, it has nothing to do with the lymph system. She had not a clue. And Ariana, who was just here, she's a fabulous nurse. She goes, Teresa, I never heard of this. She says, we're not taught this. She didn't even know the lymphatic system, that the congestive heart failure was a result of the lymphatic system failing. She just said it's just fluid building up. I says, Ariana, what do you think it is? It's connective tissue. So I took this out and I showed her. She goes, oh my God, Teresa, you're right. She said, but we were never taught that. So that's why I tell you the people who see it through different eyes, I'm going to tell you one day you're going to email me or text me and said this paid dividends. It's going to happen, folks. I don't care who you are. Somebody is going to get sick. You, somebody you love. And let me tell you, you got to go back to the foundations, back to the principles, because they're law, they don't change. And they skip that. They're so busy looking at, COPD or this or that, they didn't even realize what the cause was. Well, how can you treat something if you don't know what the cause was? That's what makes you going to be an incredible owner or practitioner because you're going to see it through different eyes. That's the truth. That's what makes this so amazing. Lori's going to be on the call next week. This is Lori. Let me go over here. She's worked with Cushing's, metabolic syndrome, and a lot of other different conditions. And she says it's amazing. She says you can turn these horses around in no time. And that's what's leading. That's how we're going to leave this. That is how we're going to move this industry forward and recognize it. And Trish is another one. She does equine somatics, and she does a combination of a practitioner of this here. Tracy owns the Rocky Mountain School of Acupuncture Massage, and we have the beautiful person here who's been with me from day one, Lorna, has impacted horses both in Washington, where she previously lived, and now in Arkansas. So we're on the roll, folks. These are people who are carving out their legacy. I want you to carve out yours. I am honored that you're part of mine, but I hope you're proud I'm part of yours. And I mean that from the bottom of my heart. Any other questions?
You said the website is fixed, that I could go get the
Yeah, you can go. You're a horse owner, what are you, honey?
a massage therapist, a horse owner. Yeah.
Okay, well, you got to, for now, what you want to do is this is for the professionals to become an equine lymphatic therapist, but that's fine. But you can
Right.
transition when you're ready. You go from horse owner to professional. We'll talk
Oh,
about,
yeah, I would like to work towards that.
yeah, well, then give me a call and I'll explain the differences and then you decide what you want to do. How's that?
Okay, because you have the brushing method, and then you have the obviously the lymph drainage method, which is
You need that. As a practitioner, you need definitely the MLD.
yeah.
That's not for horse owners. Most of them, 9 out of 10 of them, don't want anything to do with it.
Uh,
That's why the grooming technique works well.
right.
But see, as a professional, I'll just tell you, you have homework assignments. And the reason that you have homework assignments and Lorna does my evaluations for me. She helps me out with that. And is because your hand placement is very important. When you do the grooming technique as a horse owner, it's not a big deal. You do it as a professional, your hands have got to be in the right place because when you come and do MLD, they need to be very specific. A horse owner doesn't care about that. I'm going in the right direction. This is great. It follows the flow. But as a professional, you have different sets of eyes. You got to
Well,
know where your hands are.
right, and you also have to work on your touch, right? Because I mean, I do
Absolutely.
it very light.
Absolutely.
It's always like, okay, I'm moving water. I'm touching the skin. I'm moving in my mind, I tell myself, I'm moving the skin. I like what you said. I'm making space. I'm moving water. How much pressure does it take to move water? Not much.
No,
So,
not at all. No. You know what was interesting? I'm going to go back to this and I want your opinion, folks. I want to ask you something. This is driving me crazy. I get a bee in my bonnet, and I'm like, I gotta go figure this out. Okay, I'm just going to go over this. In in the cells, I don't have a picture of that here, but anyway, just picture this. In here, we have a lot, if in the extracellular fluid, that's fluid that's outside the cell. And let me see if I can get it up. Let me see if I can get this up. 1 minute. I want to get this up.
So I got to leave, Teresa.
Go
So
ahead.
we'll say
All
goodbye.
right.
Okay.
You're talking interstitial fluid?
Yeah. I'm going to go through this for a minute. This is part of the connective tissue thing. And there's one thing that we're missing in there is microbes. And that to me is very important. All right. See, lymph vessels open into this interstitial space, to the blue here. You see that? That is in the interstitial space. Where's the one I want? Let me see what this one is.
Teresa, we don't see
Here it is.
we don't see your picture.
I'm going to put it up. Somebody has a question? Okay. All right, let me go get it. Here it is. There, I got it. Okay. Did everybody see this?
Not yet.
There we go.
Oh, there we
Okay.
go.
All right.
Okay.
This is real important. Look here. This is the extracellular fluid. It means it's outside the cell. Okay? Outside. We all get that? And
Mm-hmm.
and then inside the cell we have intracellular fluid. Look what's outside the cell. High in sodium, high in magnesium, high in chloride. So, this is actually the interstitial fluid is a subset of extracellular fluid. It's a subset. So it has a lot of water, electrolytes, okay, sugar, that's, I get that. And it has hormones, those will drive you nuts. um, but the high in sodium, magnesium, chloride, I Googled that later this afternoon. I want to do a session on that because this high sodium and magnesium and chloride work together to keep, like, the magnesium keeps, I believe, the what is it? The sodium in control. No, it was the chloride.
Right.
All right. So these here are very strategic. What I want to do is, I think I'm you just got to give me feedback. I really want to put something together to explain. These are just not words here. What goes on with the sodium? What goes on with the magnesium? The magnesium, I know what it is. The magnesium blocks the calcium. If I don't know if you were on the call, maybe I can't remember, but we had a horse last year that we worked on named Hercules. He had CPL and suspensory. And when he urinated, the owner collected she goes, Teresa, there's all this white stuff, like crystals in his urine. I said, well, I don't know what that is. So I Googled it, and it was actually calcium. Calcium causes pain. And what we did is we released the toxins and all the lactic acid that was in the where he had the CPL and all over his body, and we released it, and it was calcium. Calcium causes pain in a horse. It destroys the muscles. So I want to go into how important is the sodium, magnesium, and chloride? How does it affect us, and how does it affect MLD? What do you think, ladies? Should we go for it?
Yes.
Yeah.
Yeah, I'm going to do that. And here's another interesting stat. Wait a minute, see where it is.
While you're finding that, let me just share a quick illustration, the basics to one with you, that when I was going through paramedic school years and years and years ago, um, was that if you have a bunch of grapes, all the fluid is supposed to be in the grapes, inside the skin. And that when, if you kind of smash the grapes, that the fluid will then be on the outside.
Correct.
And if it rains too much, they might split, and the fluid will be on the outside. Same with tomatoes, whatever. The instructor just used grapes, and and the interstitial fluid is the fluid that is not in the bunch of grapes. It's around the grapes.
Right.
And so that was just something that really helped a bunch of firefighters like us visualize what he was talking about. We were very fortunate to have been taught by excellent physicians who really knew their stuff,
That's nice.
and were able to get the point across to us. And so that's just a really simple illustration of, where does the fluid belong? Inside the grape, not
Uh,
not.
outside.
Mm-hmm, mm-hmm.
All right. So look at this one. This is an interesting one here. This is why oxygen is so important. Got a call from a gal out in, I forgot, where's it? Iowa? No, Ohio. And this was Wilma, her horse. She had a quarter horse, and she always stocks up. So the vet diagnosed her with equine lymphedema. And quarter horses have a genetic predisposition. People don't know it, but there's an issue with quarter horses and stocking up. All right. Nobody wants to talk about it, but it's there. All right. So she goes and she gets a blood work. So she said, Teresa, I got this blood work. Can we go over it? Do you see anything in it? Let me tell you what I did. This is why this is actually in the this is part of the introduction to connective tissue that's required. It's the first prerequisite. And here's what she sent me. All of this. This is her blood test. Kills microbes. Oh, I love that one. The horse had fatigue. Why? Because she didn't carry enough carries O2 to the blood. It was low. And now we were looking at this. I was looking at all of these things here. She had Cushing, she has equine bowel syndrome, blah blah blah. She had too much carbon monoxide in her blood. Sounds like my husband when he didn't get enough oxygen in and he started hallucinating because the gases were inappropriate. That's why O2 becomes important. So when you take this is just not the highlights here is to illustrate to you how important O2 is. That's what we did. I learned a lot from this. It's good. Somebody said to me, "Can you help me with this?" I don't know anything about it. I'll give it a gander. Well, I'll learn something. And sure enough, that's what we learned. I said, that was amazing. And then I wanted to share this with you. That was Wilma. Let me see what was the other one I wanted. Hmm. I want to go back to this photo here. This is important. If you look at this, these are the main fascia, the connective tissue. Mostly of it's the dense. It matches the lymphatic flow, folks.
Mm-hmm.
It matches the lymphatic flow. Let me see. I wanted to get this to you. I want to do that thing on the calcium. I need to get a handle on that. There was one photo here. Is this it? Oh, okay. Maybe I'm getting close. Um, that's not it. Nope. This is wild. No, it's not the photo I wanted. Um, Maybe it's in the other one. No. Oh, here it is. Look at this. Remember at the other one of the other webinars, we were talking about homeostasis,
Mm-hmm.
right? And I asked my physician and the medical student there, where does homeostasis, what is it, the relationship to the lymphatic fluid? And she looked at me and she didn't know what to say. She just said, the body's complicated. And the guy that was sitting there, he didn't say a word. He wasn't opening his mouth for nothing. Listen to this. Why are extracellular interstitial important? It's 40% of our body weight. Don't tell me homeostasis doesn't happen underneath the skin. I don't buy it. I believe it does. Think about this for a minute. We've got that high sodium, high calcium, magnesium, high chloride. And why are these so important? It's 40% of our body weight, ladies. That is amazing. This is significant to me. So when I think of homeostasis, I'm thinking underneath the skin and in the blood, in that space, those interstices where the extracellular fluid, interstitial fluid is, it's 40% of our body weight. That's crazy. Any questions? Oh, now let's go back to this one here. Here's the laminae. This is here is why it's the glue. This is when we talk about horses that have laminitis. Let me see if I can put this picture up. All right. You see the dermis? Dermis is made of loose connective tissue. All right. You go look, do Google dermis and see what it tells you. Then you have the laminae there, and you think about all of this that's going on in here, this is a very active place metabolically. All right. So this is why this becomes so important because the lamina begets the glue. It's the connective tissue that holds the bone together. So this is where this becomes important because when you think about every time the horse puts pressure on his hoof, he's pumping blood up, and then the legs and the hair help move that lymphatic fluid all the way up. So that's why I believe that we can make an impact on horses that founder and horses that have laminitis through the grooming technique or MLD. Any questions? Going once, going twice. That's that. All right, ladies, I think we did a good job tonight. Any questions at all? But you would say you would be interested in doing a call on that, right?
Yes.
I'm going to do it because I found that fascinating. I want to know the connection in that extracellular fluid. How is it impacting everything that we do? I need to get clarity and wrap my head around it. T, what do you think? And don't forget, ladies, your breast is connective tissue. It's not a pectoral muscle.
I think it's a great idea. I'm loving learning with you. Um, I'm really liking the direction of your thought. And I think that the more that we understand about the whole process, the better we can do for the animals.
We do. Let me tell you, and it's going to be better for everybody. You think about, you think about yourself. You think about somebody in your house that maybe, or a loved one that's got heart problems or lung problems or any kind of thing.
That'd be me. I'm the one who's got it.
You know, go. Here's what I'm telling every one of you. If you don't be your own healthcare advocate, they're going to bury you. And I'm just sorry. I just, after all these years, I can honestly, I really do believe that. If you're not going to be active and ask questions, the problem is we don't know what questions to ask. And when I start asking questions, they get very nervous. They shut up. I'm telling you what they do. And this new pulmonologist, she's fabulous. When I gave her my theory, she goes, Teresa, I can't argue it.
Wow.
Yep. And, and that's all I needed. You know what I mean? Because I knew I was on the right track. So if you can find a physician that you can talk to and ask questions to, that's great. Because a lot of them are afraid of legal. They tell them not to say anything. And that's why all this time I couldn't get a pulmonologist to talk to me. I had so many messages out to them, nobody would talk to me. And I says, where did this COPD come from? I'm married to this man 40 years, and you're telling me I have COPD? So, and he didn't smoke. So, yes, he was exposed in the military for environmental toxins. Definitely a player in that. Couldn't argue that. But not with all the symptoms that he was not after they gave him the prednisone and he cleared up fabulously.
So how's he doing now? Is
He's
it?
doing great.
Oh, good,
The
good.
only thing I have to do is we're trying to get the sleep apnea machine because that is key for him.
Yeah.
Sleep apnea, he needs that oxygen at night. He can't get into that deep REM sleep, because when he does, and this is interesting, he keeps telling me his hip is bothering him. I can't touch him because he's too vulnerable. It's contraindicated to do MLD on him because he's constantly fills up with water. He's on Lasix. It's contraindicated. So listen to this. So he's got problems with his hip. He'll be walking and all of a sudden his hip will go out. How I know this? I'll tell you what I think it is. I think we're going back to the foundation. When he goes into AFib and he doesn't get enough oxygen, he starts breathing heavy. So what happens is this. And then what happens? Where is the vagal nerve? The vagal nerve goes right through the diaphragm, okay, into the stomach. Then you hit the peripheral nerves to the side. And I think what happens is when he gets super tired, he doesn't have enough oxygen. The heart stops pumping more because it wants more oxygen. All right. And it sends this crazy loop to the respiratory, gets inflamed, the vagal nerve gets inflamed, and it goes down to his bowels. And guess what happens to his hip? He says it falls out. It feels like it slips. Well, if you're going to have a hip replacement, the pain is nonstop. The pain is nonstop. You have a hip problem there, the pain doesn't go away if it's bone on bone. His stops. So it tells me in his structure there that he's shot with his SI joint in his lumbar area. But I'm thinking this here, the thoracic up here, you keep pumping, that vagal nerve goes into the stomach. He'll get an upset stomach, and then a lot of times it goes out to the peripheral. And I think that's where his hip's coming from.
That's a reasonable assumption, I think. Have you talked to the VA about getting that machine?
Oh yeah, we're on that now. But right,
Okay.
he doesn't he's 20 years military. So so we're working on that. Thank God for TRICARE. I don't know. It's for the last 18 months. I can't even tell you how many times we've been through. And we always go through the ER. It's never normal. Yeah.
Yeah. Well,
And I don't live close. I'm an hour away from a hospital.
mm-hmm, mm-hmm.
And
Yeah.
Teresa, regarding the sleep apnea machine. I'm sorry, T, I didn't mean to interrupt
Oh,
you.
that's okay.
Um, Regarding the sleep apnea machine, it will take like, don't give up on it. It will take a while to get used to it. And if it has a hose, the hose goes from the machine to a mask that you have to wear, and it
Yeah.
starts making like a loud hissing noise, and there's no way you can sleep. But there are covers that you could buy for it. You're going to need to buy the cover. I don't know if the
Or a chin strap is another possibility. It might not be a well-fitting, particularly if he's, let's say 70 or older. Sometimes there's enough bone loss in the jaw as we age and dental loss that the mask doesn't seat well. And there are two ways around that. So one of them is I mean, the thing comes with elastic and Velcro and, whatever, depending on which brand you get. So, you want to tweak those, but they also have a separate chin strap that can be affixed to the rest of that headgear. And a lot of times that makes a difference in how well it fits. And especially if there's any grade of retrognathia at all, that makes a huge difference for some, mostly men, but some people with it. And then the other thing is that some of them you can ask for. Most of them have a non-inflatable fixed cushion on that face mask, and you
Oh
can.
really?
Yeah, it's a fixed cushion. It's a like a silicone or whatever, and it's a formed in kind of like a C shape or G shape or something, where it curls in on itself a little, and it seats. Well, so beards and mustaches make a difference. And then the other thing you can do is you can ask for, and some brands do this and some brands don't do this with the seating. And she is absolutely correct that this takes a while to get used to. Um, but um, but you can ask for one that can be that there's an air-filled cushion, and you just get a little 10 mil syringe and just pump it up, like a bicycle tire. And you have to change those out, every, 30 days or, 60 days anyway. You have to change the mask out. And the hose, you can also get, some of the hoses are heated and some of the hoses are not heated. And my husband does, uh, he's been using one for, I don't know, over 20 years now.
Oh, good.
And
God bless him.
yeah. Anyway, and the heated hose is just a real blessing to him. He really appreciates that. And if you have any familiarity with snorkeling or diving, you can just in wintertime in particular, it's great because you can just tuck all the way underneath the blanket and all of you is warm, you
Oh,
know?
that's nice. That's
Yeah.
nice.
Yeah. So Anyway, she is absolutely correct. It does take some getting used to for both the patient and the spouse because you have to get accustomed to the machine noise, which is, thank God, nothing like people snoring, but it takes some getting used to, and having just um the different um like if you've been to the dentist and they work for a little while, and Maggie, they'll be back, Maggie, hold on, baby girl. Yep, they'll come back, it's all right. um and you have some work done and they have your mouth held open for a little while they're working on a molar or something, and then you go to close again, you know how it doesn't feel normal, it doesn't feel right. Well, that's kind of like what the getting used to the machine is like, a little bit like that. So it just takes a little while to get used um to it, and she's right, it can take, I mean, what do you think, maybe about 6 weeks in your
Uh,
experience?
um, Actually, maybe a little less. The it's just hard to sleep, to get sleep. But believe it or not, you do sleep. I mean, like you
Mm-hmm. Mm-hmm.
sleep through the night, like you get used to all that noise. But T, what you said about the heated hose makes all the difference and all the sense in the world, because
Mm-hmm.
then you don't need to get that cover that they make. The one thing too is that you have to make sure is that you have to clean it
Yes,
daily.
yes,
That's a big, that's a crucial
yeah,
thing. You have to clean
yeah.
that daily, and don't use the antibacterial soap on it, because that can
No,
degrade. It can degrade
degrade the
the
plastics. Yeah.
material.
Yeah. And then also, I don't know if a lot of times people who work with animals are people who use essential oils. Don't go anywhere near that thing with an essential oil. It will disintegrate the plastic in no time flat.
Oh, wow, that's good to know. I don't have any
Yeah.
essential oils in the bedroom.
Yeah. Well, we use them a lot because our herd is organic.
Yeah, I know you
So,
mentioned that. That's good.
yeah. So we use herbs and essential oils a fair amount. And we've had very good results with them. We're very conservative in our use with them, but you do have to know safety things, and you have to know solubility things. And one of them is that almost all essential oils, certain ones more than others, will degrade plastic and nothing flat.
That's why they're always in glass bottles.
That's why they're in glass bottles. That's right.
Right. Yeah.
Yep. Yep.
Hmm.
Yep.
Hmm.
And if it's not in a glass bottle, that's a clue that it's adulterated with something and it's really diluted, and it's not going to be doing you or your animal any good if it's not. It needs to be in a dark glass bottle,
Right.
either
Yeah.
cobalt or the really dark amber that looks brown.
Right.
Yeah.
Right.
Yep.
Yeah.
But yeah, I encourage you to stick with that. And if you get the machine through the VA, and I can ask my husband what the name of that thing is, and I know you're in a different state, so it's going to be maybe, um, it's going to be a different person for sure, but the title of the person should be the same because it's a military thing. Um, but anyway, if you go through, it might be like a veteran service officer, or I can't remember what the title is. Maggie, baby, hold on, sweetheart. Um, and um, And so if you go through that person and get your machine through that person instead of straight through the insurance and everything, like the TRICARE and all that, if you go through that stuff, they will send you all the replacement hose, replacement filters, replacement masks. They'll send all your stuff in the mail, when you're supposed to have it.
Oh, that's good. I'm gonna.
All the,
Well, you know,
like,
but I will
not
definitely.
refills, but like refills, you know what I mean?
Yeah. Right. Right. Well, I'm hoping they said that the because it's not really going through the VA, it's going through this company called Apria with the healthcare, because we're going
Mm.
through TRICARE for Life. That's what we have.
Mhm, mhm,
So
mhm,
TRICARE for Life is paying for it. So we went through them, but that's still military. But I'm
mhm, mhm,
hoping we signed off on all the paperwork today. So I'm anxious to get it because I know that's going to be a key for him and to get him
mhm.
stable. So,
Yeah,
If
it'll make a big difference.
and if he just so you know, if he travels by plane,
no,
um
he don't travel at all, but you can't get him on a plane.
oh, okay. I was gonna say the CPAP machine, because obviously he has to bring it with him. In the carry bag that it's in, it counts. It's an extra item. It doesn't count towards your personal item or your carry.
Right.
They
It's
let
a
you.
medical equipment. Yeah.
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 So
And the other thing is that there's little cards in it. Normally, there's a little like a, like how some cameras have them, and like maybe your barn cams or whatever, for when you're doing foaling and you want to know.